Okay, so now I've just returned from the sterilising area where I would have removed all of my dirty PPE and actually washed my hands. So I've now returned into the environment where I need to decontaminate or swab the chair. So what I need is a fresh pair of gloves, and I'm still clean because I washed my hands when I left the sterilising area. And I also need to prepare my swabs. So swabbing can be done either with a pre-made solution such as Sonadet and some gauze, or you can use the medicated wipes that are already soaked in a neutral detergent. So what I need now is my swabs, and I get all those out while I'm clean. So I want a couple for each area. I'm going to be showing you the 2 swab technique today. So if any swabs happen to fall on the floor, just leave them there and we'll get them at the end of the swabbing. So we're dousing our swabs in the solution, and any excess we're just squeezing out so that it doesn't go onto our floor area. So what are the principles of swabbing are high to low, clean to dirty. So we try and keep one dirty hand and one clean hand to pick up the items. So the first area we start is the nurse's cart. So what I'll actually be doing is creating a clean environment to transfer those items once I've swabbed them onto it. So just starting at the top and working down. And then what I'm actually doing now is picking up those items, swabbing them to get an area I can actually pick them up from. This item can also be autoclaved, so it can go to the steriliser, the plastic spatula. And then obviously my patient glasses. And then doing the rest of the nurse's cart. Also the handle, just in case I might have gone in there to get something out. Now I'm going over to the dental chair, so I need to start high, which are my lights. Okay, and then I'm coming down here to do the back of the headrest in case it's been adjusted by the operator. And then I'm actually doing the headrest. And a lot of this area has been protected by the patient, but a lot of people like to give it a swab just to make sure. Okay, so sometimes you have to move things if they're in your way, so just moving them without overly touching them if you can. Okay, so now I've done nurses, handle, the dental light and dental chair. So now I can actually use this swab to actually swab my assistant's chair. So what I want to do now is swab this area that's been close to the patient, and down here on the handles if I've happened to adjust the chair when the patient came into the surgery. So that's the end of my first swab. I then get my second swab, and now I'm going to start over here again, high to low. So in my bracket area, I want to actually do this area where the metal tray has been. So just swabbing it down, lifting that up with my clean hand. Okay, and then the handles. And then starting relatively clean to dirty. So in our scale and clean procedure, our ultrasonic area is quite dirty. So I usually like to start here at the triple syringe, making sure I do the cable and the return. And then moving along the unit, making sure I have a clean environment to pick up before I move on. Okay, once you're happy with the chair that the bracket has been done, you can then move over to the assistant side. And again, we're going clean to dirty. So this area is quite clean and the buttons are quite clean. Then we come down to your control panel, which you might not have used much. And again, we're going clean to dirty. The high volume is usually the dirtiest. And then we're doing the outside of the spittoon to the inside of the spittoon. And then removing our dirty gloves and carrying out our hand washing technique.